Hello everyone, my name is Shavan Joseph and today I'm going to be presenting to you about Westchester County housing issues. So Westchester County is the second most populous county in the state of New York and has a population of about 950,000 based on 2010 census. And Westchester County ranks 3 in the health outcomes as per County Health Rankings. Analyzing all the determinants of health in Westchester County, the one healthcare disparity that stands out is the severe housing problem. The percentage of population with severe housing problem in Westchester County is 25%, and comparing it to the US top performers, the score is 9% and 24% in the whole state of, as a whole in the state of New York. So what is housing problem? The housing problem is determined by the following features according to the county health rankings: a housing unit that lacks complete kitchen facilities, or a housing unit that lacks complete plumbing facilities, or a household that is severely overcrowded, or a household that is cost burden. If there are any one factors or multiple factors, then a housing problem exists. What is the epidemiology of the housing problem? Housing conditions are directly related to economic factors. Wealthy people afford a better living condition in a better house with all amenities, whereas low-income group tend to be segregated in one place and do not have all the facilities for a healthy home. Vulnerable populations such as racial minority, elderly patients, elderly senior citizens, and population with physical and mental disability, they are most likely to face housing problems. And poor housing conditions affect the physical and mental health of these vulnerable population. So how are housing and health related? Severe housing problems lead to health problems such as chronic diseases, infection. It affects the development and growth of the children. And the housing problems affect health in two ways, either direct or indirect pathways. Structural features of the home, such as mold, pest infestation, peeling of paints, drafts and energy insufficiencies, physical crowding, all these directly impact health. Whereas affordability, such as fear of eviction, housing costs, overcrowding, stability, which is defined as frequent moves, or in its extreme form, homelessness, these indirectly impact health. So now comparing housing problems between Westchester and its neighboring county, I chose Bronx. Bronx is a neighboring county of Westchester with an estimated population of 8.5 million according to 2017 census, and Bronx ranks 62 in health outcomes. The percentage of population with severe housing problem in Bronx is 39, and when it's compared to Westchester County, it is 25%. According to the Institute of Healthcare Improvement, socioeconomic factors and physical environment are a major contributor in the outcome of the health of the population. And we see here Bronx has a housing problem of about 39%, which has brought down the ranking of the health outcomes in Bronx to 62. So interventions that are in place to address housing problems in Westchester County. Westchester County Housing Opportunities Commission, HOC, and the Center for Urban Policy Research, CUPR, have developed data and analyzed it to identify the housing problems that's existing in Westchester County. And the CUPR used income, housing condition, and housing expenditure of households in the county and came up with 3 variables to address the problem of housing. They are affordable housing demand, matching the demand and supply, and housing supply. Now let's look into these 3 variables. As existing affordable housing demand. HOC and CUPR, after reviewing of the collected data, identified 3 housing conditions which indicates that the housing problem exists in the county. They are household living in deficient conditions such as lack of fuel source, plumbing, or kitchen facilities, or households living in overcrowded conditions, or household paying a large portion of their income for housing. These are the same housing problems that was identified by the county health outcome rankings. And then matching the demand to supply. So computer algorithm matches low, moderate, and middle income household to existing problem of housing. So the computer does the calculation, what household has what type of housing problems, and then when you determine what type of housing problem is needed, the solution to the housing problem becomes easy. And then the final is the solution, which is housing supply, and that takes place by physical design and programming of residential space to promote health, preserving, improving, and making the existing house better, and expanding supportive housing options for special population such as senior citizens, physical disability or mental disability, or for ethnic minority. What is the healthcare provider role in our overcoming housing problems? As a healthcare provider, the first step in overcoming problem of house is identifying patients who have health problems related to their housing condition. And in order to identify this problem, a positive patient-provider relationship is needed, which allows the healthcare provider to investigate the condition of the housing of the patient. And once the housing problem is identified, appropriate referral to local public housing authority should be made, where help to improve the housing condition can be sought. The provider can also lead in advocating for housing policies to ensure access to affordable housing for the vulnerable population. And with every patient encounter, education should be provided on ways to make homes healthier and safer. These are some of the ways a healthcare provider can play a role in overcoming housing problems. And what type of patient-provider relationship is needed in addressing this issue? The type of patient-provider relationship that will result in positive outcome in addressing housing problem is one that is between a coach and a player, where the patient and the provider are in one team, and they have a common goal of improved health outcome. Here, the provider acts as a counselor, friend, and teacher to help patient make their living condition better by living in a healthy home. So, what are some of the facilities that exist in Westchester County to address housing problem? Westchester Residential Opportunities has been instrumental in providing housing opportunities for low moderate income households, minorities, senior citizens, persons with disabilities, including psychiatric disabilities. Westchester County Government Housing Department also assists in addressing housing problems for its county residents. And in the organization that I work, which is a nursing home, social workers work closely with the community resources to ensure that the residents, after being discharged from the nursing home, are remain safe in the community in a healthy home. Social workers also ensure that the residents have healthy homes to reside in the community, and they conduct assessment of the living condition before discharging them to their homes. And if the resident has no home, they are usually referred to an assisted living facility or shelters where they can remain safe. Some of the suggestions that can lead to improvement of housing problems in Westchester County. Westchester County continues to have 25% of its residents facing housing problems, although there are facilities and policies in place to address housing issues. As a healthcare provider, we can participate locally as well as at the state level and advocate for the revision of current guidelines and housing codes to ensure that homes are healthy and are in a livable condition. Inclusion of quality of housing and environmental assessment during community assessment, which is undertaken by the Department of Health every 6 months, and the prompt follow-up if any inadequacy in housing is noted, and increase of public awareness of the harmful effects on the health due to housing problems by conducting educational campaigns, and also provision of financial assistance to improve home condition. These are some of my suggestions which can improve housing condition in Westchester County. So in conclusion, socioeconomic and environmental factors are major determinants of health. Severe housing problem is responsible for health problems such as infection, injuries, and also affects the growth and development of children. The percentage of population with severe housing problem in Westchester County is 25%. Addressing the housing problem will improve the overall health outcome of the county. Thank you for listening to my presentation.